I don't think I have to repeat what Senator Cornyn has said about the problems, the political problems of solving this issue. They could go away fast if the border was secured. And, 3 and 3/10 million people already in the 18 months of this administration crossing the border. And then we have the absurd statements by Vice President Harris, quote unquote, the border is secured. I think I've heard Secretary Mayorkas say the same thing. So, Sheriff, I know that you also personally witnessed this impact at the open border. I guess you've already made a strong statement in regard to that. So, my first question is, you previously attributed migrant deaths to, quote, the false compassion of open border, end of quote. I think that's a superb description of what we're seeing at the southern border. I'd like to have you elaborate on that phrase.
Yes, sir. What's occurring here is just they're being taken advantage of, and they're being left to die. It's not a good death because they know they're dying. It's not and what I mean by that, it's not a quick death and that they're just going to die as you would in a crash. But we got lots of 911 calls when you hear the last desperate voice on him saying that tell my mom I love them, tell my sister, my wife, children, whatever the case might be. We just picked up a 15-year-old that we recovered from the brush. And that not only, Brooks County has numerous deaths, but now the whole Southwest corridor is experiencing it. I got bodies from Maverick County, Texas, in my morgue. I have a morgue myself in Brooks County that we house other bodies that are recovered from the different counties because it's a surge. And until we secure that border, until that is shut down completely, then we can start working on everything else. And I understand the health issues. I understand what they're trying to say, but it's policy. The policy says, come over. And that's the rhetoric. That's the narrative that's occurring right now. The narrative is come over. Well, guess what? We need to do it correctly. This is why I set the rule of law. It's got to be done correctly. I'm a Democrat, but it's just pathetic how things are going currently along the border, along the Southwest corridor.
You've talked about the role played by transnational criminal organizations in migrant deaths that we've seen at the border. Like to have you tell me, how common is it in your county to come across migrants who are in need of medical care and attention?
I did visit with the secretary twice, sir. He was down in McAllen, and I visited with him twice, and I told him what we needed. We needed a simple triage so we can get the medical assistance that they need quickly. And I haven't heard anything back from them. So we need that. And I know what we need in Brooks County. They're just not listening to some of the sheriffs, including me, as to what's needed. If we just, and this is just for a quick fix. We don't have a hospital in Brooks County. Everything has got to get flown out to different hospitals that can manage these type of issues. But a triage will definitely help to immediate assistance. Border Patrol, they're gentlemen that are EMT. They apply IVs, but by the time they apply that IV, sometimes it's just too late, and they succumb to the heat or to the cold. I mean, we picked up 5 bodies at one time. At one time, when we had the freeze back several years ago, they're all stuck together. I mean, that's just not right.
My last question, could you describe how transnational criminal organizations handle migrants who get sick or experience health problems? And more broadly, to what extent can you comment on the impact that migrants in need of care have on the local health care infrastructure in your area?
Well, in my area, in comments to that, in my area, we don't have that because we don't have a hospital. But what it does take is the fact that our ambulance services that have to go out to the ranch lands, pick him up, and then transport him, that leaves our community open to other issues that we have. Our county is elderly. They over 60, 65, 70s probably, meaning So they need the medical assistance locally. But when we're out there treating them, then that becomes an issue. Now, as far as the transnational gang members, they just leave them there. If someone just happens to get hurt, they get sick, they're gone. They're there on their own. They fend for themselves. Now, thanks to Border Patrol, we have a lot of placards out there, probably over 200 placards, and put in different areas. We have beacons. Everything that can be done is being done in Brooks County to save lives. I work closely with the consulates. There's 4 consulates I work closely with, and down in the McAllen office, and we give them a lot of literature to forward down south so they can understand what's going to happen to them if they come into the United States, if they come into Brooks, the dangers that might be happening. So everything has been out there. The outreach is there. Whether they're the fact is, transnational gang members, they just don't care. It's all money's for them.